Hello, I'm Magdalena Simonas and I'm a general practitioner. I'm co-chair of the Women in General Practice Committee. We're hosting today a conference, RACGP conference on domestic violence, and we've had an excellent lineup of speakers which include Australian of the Year Rosie Batty, followed by Rob Hulls and Carolyn Burnside, barrister, who've given some very important information regarding the role of the general practitioner. We'll now hear from some of these speakers.
When you consider there's 1 in 3 women affected by family violence, 1 in 4 children, you have to consider that in your own practice you have victims of family violence. And so GPs who are central to the community and who women and children visit on a regular basis for any kind of health-related concerns, GPs play an integral part in identifying perhaps some initial concerns that women may have, and so they're integral as part of a journey.
I think it's most important that GPs remember that their notes are really important. Insofar as the court experience is concerned, the notes need to be detailed in terms of the injury. However, beyond that, it's important that doctors say that this is not necessarily a verbatim, it's not necessarily a comprehensive history as such, and that they realise that their role is a doctor and not a detective. I think that's most important. If there is any discrepancy, that it may be that your notes were wrong. Don't be afraid of outlining that there may be an inaccuracy involved with taking notes and dealing with a patient at the same time, because that's quite difficult. And that's why police use tape recorders, but doctors are meant to do it, write it down absolutely accurately, and that won't always happen. Most often women will be finding it easier to communicate with a doctor than a policeman. So it's really important when people get the confidence to actually say, well, actually I am being violated, that the relationship between the doctor and the patient is conducive to her opening up. I think that's crucial.
Well, I think GPs and lawyers need to realise that often the first port of call in relation to a family violence matter won't necessarily be a lawyer, could well be a GP, and the GP needs to ensure that they look at these issues in a holistic way. Lawyers also need to look at family violence issues in a holistic way, and GPs and lawyers need to work far more collaboratively. Well, I think often a GP will see a patient and not realise that underlying the reason the patient has come to see the GP is a family violence issue. So yes, there might be some trauma, yes, there might be some injuries, there might be some other issues that the GP thinks the patient's coming to see the GP about, but there needs to be some questioning to ascertain whether or not there are family violence issues involved.
One in 10 women have been affected by domestic violence, and it's reported that 1 in 3 women have had some violent experience in their lifetime. So the role of the general practitioner is central, as many of these women will present to the GP for the first time. To date, we've had very little formal education around how to deal with these particular consultations. So today we've heard from some of the experts regarding our role and how we can question these patients and in a delicate and sensitive manner, and address their issues and provide their support and also ensure their safety. Rosie Batty touched our hearts. Her story is very personal and it's very sad, and she identified the role of the GP as being central and how important the general practitioner was in her particular case, also in supporting her through our anxiety. What she actually indicated and demonstrated was that no one in the community is invulnerable to family violence. No woman is invulnerable, and that it occurs a lot more frequently than we expect, and that in general practices where we say we've probably not seen it, it is more than likely occurring, but perhaps we're not identifying it. and that we have a really important role in supporting women through this.